skin is a very important organ. We want to talk about how you need to treat it. We've got Art Pellegrino here, so Vice President of Research and Development, Elizabeth Arden. Welcome back.
Thank you. It's great to be back. It's good to see you too.
Now we need to hear your skincare tips so we can look as radiant as you do, Art. So through the ages, a lot of us in our 20s don't necessarily start thinking about skin care, but you have to start thinking even from your 20s, you say.
And your skin is the largest organ in the body, like you said. And it protects us, our interface between us and the outside world. So it's really important from a health and beauty standpoint.
What should we be doing when we're, a little bit young and reckless, maybe hanging out all night? Are there things we should be feeding into our skin so that we look better into our 60s, 70s, 80s?
Absolutely. And there are things that every woman at every age should be doing. So I like to start by talking about the fundamentals.
Sure.
You can have a simple skincare routine with just a few products that you can follow throughout your life. So it'll be simple but effective.
Okay.
Navigating the world of skincare is certainly complex. Serums, creams, day, night, neck, eyes, lots of choices. But if you have a good cleanser, a good serum or treatment, a moisturizer with SPF, and an eye product, those are what I consider the basic must-have products. Any woman, any age, any ethnicity.
So the serum or treatment, that would be for your whole face, not just for your eye.
Correct, but now there are separate, when you make a choice for your eye product, and it's very important to have a unique eye product versus your daily moisturizer. I like to say you wouldn't use your body lotion on your face.
Right.
You shouldn't use your facial products around your eye. The eye is the thinnest skin on the body. It's 10 times thinner than the rest of the skin on your face. And the muscles that cause the contractions and blinking mechanisms in our eye are very strong, and they're directly attached to this delicate skin. There's no layer of fat to buffer that. So just imagine these strong muscles, this delicate skin. It's no wonder the eye area shows the first signs of aging. Okay,
so you need to have basically these 4 basic
That's
things.
The basic
Get into a regime.
And then if you have, a lot of oil or a lot of dryness, or you want a special night product, then you supplement. But those I consider the 4 basics.
Now, so in your 20s, you're following that basic regime. You're probably making sure you've got some SPF going on as well.
Well, there's a couple of basic technologies, too, that you want to make sure you use throughout your whole life.
Yeah.
SPF for sure, a 30 on your face. And don't forget to use it, all the way down to your décolleté.
Yes.
It's sort of a sun magnet, right? If you look, that's where really a lot of women show their signs of aging.
Absolutely.
Crepiness, redness, so it's really important to use it. Don't stop at the jaw. Skincare doesn't stop at the jawline, right? Then it's also important to use a strong antioxidant because even the best SPF doesn't block all of the UVA and UVB damage from the sun, and the SPFs do nothing to combat the effects of pollution and smoke. So all of that causes free radicals which need to be quenched in skin with a strong antioxidant. So those are 2 must-haves, even in your 20s and throughout your life.
Okay.
Then in your 20s, retinoid is maybe more of a nice-to-have. But I still like to recommend it because it optimizes your cell turnover. It builds a strong collagen and elastin matrix, which really, it's a bit of a preventative of those first signs of aging, but it'll really keep them from coming earlier. Later on in life, a retinoid becomes a must-have as you're trying to reverse the signs of aging.
So you're looking for a retinoid in your product. So are we talking now in the 30s and 40s?
So as you get into your 30s, then your lipids and ceramides really start to diminish.
And what are those?
Those are the ingredients. If you think of your skin like bricks and mortar, the cells are the bricks and the mortar is the lipid that holds everything together. It creates a strong moisture barrier, really keeps your skin moist. But in your 20s, you start to lose them, and in your 30s, they really start to diminish. So it's really important in your 30s to start using moisturizers and treatment products that replenish those lipids and ceramides.
So more moisture. And in your 40s, what should you be focusing on
So then you're really seeing the signs of aging start to become more pronounced, lines and wrinkles.
Says you, Art.
Well, not if you take care of yourself.
I think I probably skipped about 15 years of proper skincare. I used to use soap and water on my face for many, many years. Always a moisturizer, but soap and water, for crying out loud. So I have a bit of catching up to do, but it is true, the sooner you start, the better it's going to be when you get up there into your 40s and 50s and 60s.
So that's why more powerful anti-aging serums, retinoids, peptides, because now you're really trying to reverse that damage,
right? Okay, so we've covered your 40s.
So pretty much, yeah. You're looking for, and at that point, what I like about the regimen that I've described is it's good for all skin types and all ethnicities because the same causes of aging occur in every woman. They may manifest themselves differently.
Yeah.
You know, black women may have loss of firmness and hyperpigmentation. Asian women may be more oily and more concerned about pores and age spots, and Caucasian women, lines and wrinkles, and a loss of firmness. But all of those things are caused by collagen and elastin loss, melanin production. So all the solutions that I'm describing are appropriate. Now, you may choose a form, a creamier cleanser versus a foaming cleanser based on your skin type. But the basic structure of your skincare routine and the ingredients really work pretty universally.
Okay, let's talk a little bit about just maybe some myths out there when it comes to skincare. How often should you be applying an anti-aging serum to your face? Is this something that you're using daily? Is this something that you use?
Definitely daily. Ideally morning and night. Now, you know, your skincare routine is complicated. You're rushing around in the morning.
Yeah.
So if you're going to choose one or the other, probably nighttime is the best when you've got time to maybe take a little bit more time.
Yes.
But ideally a serum twice a day.
Do you need an eye cream and an eye serum?
So it depends. You know, if you need moisture around your eyes, and usually an SPF around your eyes will come in a moisturizer form.
Yeah.
But then if you're really trying to address lines and wrinkles, dark circles and bags, then you may want to step up to a more powerful serum. So a cream and a serum, you know, it maybe seems like a lot, but both are good products for your eyes. But you definitely want to get that SPF. Your eyes may not be able to tolerate a 30, so an SPF 15 around your eyes is fine. But you know, the sun protection is really key.
It's really key. Okay, so if you need it, you need it. You're saying if you need both, just go for it.
Right.
You can
and
do
as
both.
your signs of aging, you know, get more pronounced, you may want to add a serum.
Right. Thank you so much, Art.
All
Art
right.
has brought all of you Pravage anti-aging neck and décolleté firm and hair cream. It's a mouthful. Enjoy.